I'm Dr. Leslie Wakefield. I'm a therapist here at Wellsprings Health, and I have a question today about penetrative pain, specifically pain with deep penetration, and what can be done about that. In my experience, women who are experiencing this probably have either a very sensitive cervix or a hypomobile cervix, a cervix that's restricted in its mobility. So it's getting bumped into and either can't move out of the way or is uncomfortable to that touch. Or potentially they've had a surgery like a hysterectomy, and so the top of the vagina, which we call the vaginal vault, is sensitive or restricted. There may not be a cervix there, but the tissue there is sensitive or restricted. Or a third option is if someone has had inflammatory or pain conditions of the pelvis, for example, like endometriosis. And that can lead to physical restriction, but also sensitivity of the nerves there. So we do a lot in clinic to treat that, but what can women do at home if they would like to engage in penetrative sex, specifically to help avoid that pain with deep penetration? And the first advice, which most women, honestly, it's kind of a moot point, they've already tried it, but we say, can you change position? Is there a position that's better for you? Can you shift your hips right or left? Can you change the configuration with your partner? Is there a way to sort of move around that pain with deep penetration? And in many cases that works, but not always. It's not always adequate. So we have a tool that we recommend for home use, and calling it a tool is not particularly sexy, but let's just use that word for now. And then if you decide to take it home, you can call it a toy. But it is actually a tool, and this is about to become a product review. This is called the OhNut, and I'm sure that's backwards in the camera. But the OhNut is a tool marketed specifically, designed specifically for deep penetrative pain. And what it is these series of sort of jelly-like, see if I can get that into the camera, jelly-like silicone rings. And they come in a set of 4 rings. And the idea is that you would put these rings over the penetrating object. So that might be the shaft of your partner's penis, it might be the dildo, whatever is being used for penetration. And they're compressible, they're very soft. And so ideally, hopefully for your partner, it's comfortable. And if you have pain only with the very last, let's say, centimeter of full penetration, maybe you only need 1. If you have pain with the last 2 centimeters of your partner's size, you might need 2. So the more sensitive you are and the less penetration you can tolerate, the more of these that you would place on your partner. The more of these that you would place on your partner, and they effectively block the depth of penetration while maintaining comfort for you and your partner. They come in 2 different varieties. There is, let's pull this out for you. This is their standard, and this is their wider. So depending on your partner's size, because we want this to be comfortable for them also, you can choose the set that's right for you. It's not prohibitively expensive. They are washable and disinfectable. You can use them with lubricant just like you would anything else during your sexual activity. And they're generally pretty safe to use. And most women report back that while it wasn't particularly sexy to introduce this to their relationship, that when their partners are on board, it's really easy to use, and it gives them this sense of confidence that their partner's not going to accidentally go a little bit too deep and cause them pain, so that now they can relax, because many of them have very supportive partners who are already very careful, but there's that kind of back of your mind fear that maybe it's going to go just a little bit too far. What if they hit that sensitive spot? And so this is both a physical block, but also a sort of a mental relief to feel like you can be uninhibited and let go, and your partner can do the same, and you're still going to be at that safe level of penetration without worrying about hitting something painful. And then in the meantime, our patients are doing therapy. They're coming in to see us, we're giving them homework, they're doing self-treatment at home, we're doing treatments here in the clinic, with the goal, of course, of, for some women, eventually not needing this. Depending on if you had a surgery or the depth of your vaginal vault, sometimes this might just be a forever thing, sometimes this is a temporary thing, but it's a really nice tool to have available. It's over the counter, you can buy it on Amazon. For some of our patients, if they're uncomfortable having it go to the house, we'll actually order it to the office and they can pick it up from us. And so we find it to be a really useful tool. Again, this is called the OhNut. Highly recommend for pain with deep penetration. It comes in 2 variations, the classic and the wider. It is the stretchy 4-ring buffer, and I'll provide a link to that on the newsletter if that helps. Talk to you guys soon.